Hello. Today we are presenting on breast cancer, an important global public health concern. Myself, Arman Khan Bihari, and I will be doing introduction part. I'll start with the acknowledgement. We acknowledge and pay our respect to the Kono people, the traditional custodians whose ancestral lands we gather on. We acknowledge the deep feelings of attachment and relationship of the Kona people to the country, and we respect and value their past, present, and emerging connection to the land and cultural beliefs. Here is the detail of the participants. Here's the table of content, and I will be focused on introduction. I will start my introduction with a question. Why breast cancer is an important global public health concern? So, breast cancer is a global public health issue due to its high morbidity and mortality rates worldwide. It is a leading cause of death among women globally, with significant disparities in survival rates between high income and low income countries. In Australia, breast cancer accounts for a substantial proportion of the cancer burden, affecting thousands of women and their families each year. So breast cancer impacts individuals, families, and communities in multiple ways, like social impacts, economic impacts, and health impacts. So let's begin with the social impacts. Breast cancer affects the quality of life of patients and their families, which influence their social dynamics and support systems. So what are the economic impacts of breast cancer? So as per economics, it is the cost. It's a higher cost of treatment of breast cancer, which can be substantial, leading to financial strain on patient and healthcare systems. The average cost of treatment of breast cancer in Australia can range from 10,000 Australian dollars to 100,000 Australian dollars, depending on the stage and type of treatment required. When we compare the cost of treatment of breast cancer in India, it varies from 3,500 Australian dollars to 35,000 Australian dollars. So let's focus on the major health impacts of breast cancer, where it leads to significant morbidity and mortality rates, which will affect the physical and mental health of patients. So I'll be going into detail of health impacts. So in 2022, it was predicted that 20,640 new cases of breast cancer would be diagnosed in Australia, making it the second most commonly diagnosed cancer in the country after skin cancer. The mortality rate of breast cancer in Australia is also significant. In 2022, it was estimated that 3,240 people would die from breast cancer, with 3,178 of these being women and 36 men. So it also affects the men too. When we compare this data with India, in India, breast cancer also poses a significant health challenge, with an estimated 178,000 new cases diagnosed in 2020. The mortality rate is higher in India, which with approximately 90,408 deaths in 2020, reflecting disparities in healthcare access and early detection. Sorry.
So my name is Donny. I'm going to talk about the epidemiology of the challenges in breast cancer. So in Australia, the most commonly diagnosed cancer for females, especially for 40 to 59, and then the second most commonly diagnosed cancer as well. 1 in 7 women and 1 in 550 men are diagnosed with cancer. And then in the last 10 years, breast cancer diagnosis has increased by 24%. About 140,000 people were alive with breast cancer between 2011 and 2020. And then we can see from this one, like incidence and death from 1990 to 2024 has been increasing. And in India, breast cancer is the most common cancer in about 28.2% all female cancer in 2022. And we can see from here, like Australia and India, the incidence went from 9,800 in 1994 to 21,000 in 2024. And then the death rate in 2021 and 2022 is almost the same, like 3,100. And in India, about 39.1% incidence rate from 1990 to 2016, and then the death rate is about 13.7 per 100,000 in 2022. And then the factors relating breast cancer, we can see like age, obesity, and then tobacco use and postmenopausal hormone therapy as well. And the 5-year survival rate in Australia is about 79% to 92% in 2020. And then in India, about 68% in 2023. And then the highest incidence rate in Australia and the Western Europe, North America, and then the highest mortality rate in Melanesia, Polynesia, West Africa, and Caribbean as well. About 2.9 million in 2040 will be cancer cases projected, comparing to 2020, which is like 2.2 million.
So my name is Junaid. My topic is social, economic, and environmental determinants. So first one is social determinant, which is education and awareness. Australia's high level of education system, so there is better risk for the early detection, whereas India is a poor rural area. So despite there is awareness is very less. Where cultural belief, Australia has fewer taboo, so there is open breast cancer discussion, whereas in India there is a cultural stigma, so there is no open discussion for that. And healthcare access, the Australia has a universal healthcare system which provides access to the screening and treatment, whereas in India there is limited access to this cancer screening and treatment. The second is the economic determinant, in which the income level, Australia has the higher income level, so they have the broader access to the treatment, whereas in India there is low income and poverty in the rural areas, so they have lesser access to the cancer care. In insurance coverage, Australia has the universal healthcare like Medicare, which gives the woman to the access to the breast cancer, whereas India lack of health insurance. So they have to buy the out of the pocket expense. In employment, there is in Australia has the stronger labor protection for the treatment and recovery, whereas India there is no such thing. And in environmental determinants, first is the exposure to the carcinogen. Australia has the greater exposure to the carcinogen like benzene, arsenic, plastic production. And so there is a limited restriction to the industrial pollutant, whereas India has the high industrial pollution. In diet and lifestyle, Australia being a Western country, they have Western diet and alcohol consumption, so they have higher risk. Whereas India, it is an underdeveloped country, so they faces the malnutrition, which causes the breast cancer. In geographic and climate, Australia has the higher exposure to sunlight, so they have better vitamin D levels. So in India, there is diverse climate and diet patterns, so they have lower vitamin D, which causes the breast cancer.
My name is Mahasin Aslam, and my topic is impact of globalization on the global public health challenges. Globalization, with no doubt, has increased the interconnectedness, has and significantly affected behaviors toward health and access to the care. It has both positive and negative impacts on breast cancer awareness, lifestyle, and access to the healthcare system in Australia. So the first impact that is had would be on increased human interaction and health information. Initiatives like National Breast Cancer Foundation has helped a lot raising awareness about breast cancer in Australia. Campaigns on online platforms and access to the diverse health resources and support groups have also been empowering women to take charge of their health decisions and to have regular screening benefits. Global collaborations with WHO has also enhanced the reach as well as the quality of breast cancer prevention. The next is the cultural influence and lifestyle changes, and it has also changed the globalization of the breast cancer awareness a lot, as the availability of processed and fast food with high calories and low nutrient has widespread due to the globalization, which has caused obesity, which is a well-known factor for breast cancer. The drinking behaviors and the social norms attached with it is also a high ranking rate of alcohol-related breast cancer cases. And the shift towards increased screen time and desk jobs because of globalization has reduced the physical activity that helps regulate hormonal and weight levels. The third factor, which is the access to screening and healthcare services, has also like globalization because of this has facilitated widespread awareness movements, like giving birth to initiatives of Breast Screen Australia, which offers free of cost mammograms to the women aged 50 and 70 years. Cancer Australia is another government agency that aims to improve and provide access to all Australians for screening irrespective of their background. Global partnership has led to better access to screening technologies along with funded clinical trials and resources for breast cancer in Australia. Now, when we do the comparison of a developed country like Australia with a developing country like India, we can see clearly that the internet penetration in Australia is over 90%, while in India it's just about like 50%. And the increased awareness in Australia is high because of the health campaigns, but in India there are still some cultural stigmas around attached about discussing breast health. On the other hand, in Australia, we have like comprehensive screening programs like Breast Screen Australia, but in India, we had state-specific implementation with varying reach and effectiveness, like NPCD-CS. And also in Australia, the screening for eligible women is free of cost, but in India, it's free screening, but only during community health camps.
Hello guys, my name is Parth Patel and today I'm talking about some strategies to control the breast cancer in the Australia as well as in the India. So there are so many strategies to control the breast cancer in all over the world, but today I'm talking about the like main two and most effective strategies out there. So first one is the screening program, and second was is public health campaign. So in the screening program, there are some evidence suggests that it will detect the breast cancer in early stage, in the more treatable stage, and it will cost effective. In the screening program, there are like three modalities where you can like check for the breast and detect the breast cancer. First one is the breast self-examination. Second one is for the clinical breast examination, and third one is the mammography screening. And on other hand, like in the public health campaign, we do the two main things. Like we can increase the awareness about the breast cancer, and also we can like promote the lifestyle changes in the like young females and all the females out there. So for the breast self-examination, so it is like generally recommended the woman below age of 13, and in which like you have to, for the women you have to do like your self breast examination, and if you find any changes in your breast, then you need to like contact your nearest doctor. And like I am in the following slide, I am discussing like which change you find, you need to contact to your doctor. So yeah, this is the changes if you like feel in your breast, then you need to contact your doctor. Like first one, if you feel in the mass and the lump in your breast, there is like changes in the color in the breast, or the nipple, inverted nipple, or the bloody nipple, or if you find the dimpling in the skin, then in this scenario you need to contact your nearest doctor as soon as possible.
Hello, I'm Saad Ahmed. As my fellow colleague highlighted some of the screening programs that are used to tackle the challenges of breast cancer, I will also be highlighting some of them. The other one is the clinical breast examination. It is usually done annually or biannually by a physician beginning at the age of 30. In India, there are several studies that suggest that it has proven beneficial, whereas in Australia, there is inadequate data to support it. Afterwards, another successful technique is the mammographic screening. Mammographic screening, when done on population level, has produced good results. Evidence shows that organized screening programs reduce mortality by detecting cancer at an earlier stage that is more treatable. In Australia, the Breast Screen Australia programs offer free mammograms for women over 40 years of age who can have a free mammogram every 2 years, and they also actively invite women over aged 50 to 74 to screening. It is estimated that around 8 deaths from breast cancer will be prevented from 1,000 women screened every 2 years from age 50 to 74 based on evaluation of mammographic screenings in Australia. There is no such evidence available for India. Another important technique to challenge this global health issue is the public health campaigns. Campaigns aimed at increasing awareness about breast cancer symptoms and promoting self-examinations can lead to earlier diagnosis, as well as the encouraging lifestyle changes through education on diet, exercise, and alcohol consumption can reduce risk factors associated with the breast cancer. These are some of the references from where we prepared our presentation. I would like to end my presentation with a famous quote from an American author: "Optimism is the faith that leads to achievement. Nothing can be done without hope and confidence." Thank you.